is. We have a fairly small agenda today, and we're going to spend the vast majority of it on the media campaign.
Tried to tuck a draft run a show over to you today, Alan.
And use your phone, whoever you are.
I mean, you basically gave me the big point pieces of it.
Okay, great, thank you. We're going to spend most of our time today talking about the media campaign. We have a lot, I think, to consider as we start to pull that together. I do want to start by thanking the Charlotte Executive Leadership Council and the Charlotte Regional Business Alliance for their endorsement of our sector-specific toolkit. We thought that was really a great endorsement of the work that this group has done, and I've gotten a lot of really great feedback about that. So I hope that you are pushing it out to as many of your groups as possible, because it seems like there's a lot of really good information in there, and people are getting a lot out of it. So I do want to start with that. We did have a group at the end of last week. Michael Smith, Jennifer Appleby, I know Charles Bowman, and Jennifer Weber and a few others got together and talked about the media campaign. And so at this point, I'm going to turn it over to Michael Smith and Jennifer Appleby to walk us through what they're thinking about. We did send the PowerPoint out. I'm not going to share it visually here, but we did send the PowerPoint out to the group over the weekend. So Michael, Jennifer, you're going to take it away.
Great. Dina, thank you. You guys heard from Jennifer the last time we were together. This is great work that Ray Ward has pieced together as a strategy, and I applaud the way Jennifer has pulled in other marketing and creative firms that can join us and be a part of this to put together a really thoughtful way to compel everyone to understand that we all need to take responsibility for the way we act collectively to take care of ourselves and to take care of others. And Jennifer has put together, and we've reviewed and worked with her and her team, a really solid strategy for this. And Jennifer, do you want to walk us through it?
Yeah, do you want to pull it up, or should we just kind of go through some of the points quickly?
Dean, I don't mind sharing it.
Oh, that's fine. Go ahead. That'd be great.
Can you guys see it now?
Yep, if you can just go full screen on that, then it'd be helpful. There we go. Okay, so Michael, why don't you just go to the next slide? So, you know, I think as we've discussed with this group, you know, as we continue to reopen, we discussed the need for a public service campaign to build awareness and education around the need for our citizens to responsibly do their part, especially in keeping our communities safe, healthy, and strong. So next slide just gets into some of the why. Obviously, again, we've discussed this as a group, but you know, after the restriction was lifted on May 8th, you know, we noticed that a lot of people were ignoring or not properly following the guidelines. And we also know that the threat is really great to the health of our citizens and our way of life and our local economy. So we want this campaign to share best practices for our citizens to better understand that it's not just about them, but around some of our more vulnerable populations. And then also to get these safety guidelines into our community's routine and encourage everyone to want to be part of this movement that proudly shows our concern for each other, our businesses, and the health of our community. So, you know, Dina mentioned that she asked several folks on this committee to go away and kind of think through how we might do this. And so we were really thrilled, not surprising, this is Charlotte, that a lot of people stepped up. So we've got a consortium of organizations with marketing and communications expertise. So between Michael Smith and his team, they've been fabulous at Center City Partners. My team, Peggy Brookhouse at LGA, has stepped up, and we'll talk a little bit about the campaign they're doing at a statewide level. And then also our friends at ACNM, a multicultural firm, they've also raised their hand and stepped up in a big way, and they're going to be a huge part of helping us get the word out with this campaign. Michael also talked about the Charlotte National PR Advisory Group. And he can talk a little bit more about them, but lots of representatives from public, private, and nonprofit. They're going to help play a leadership and activation role. Jennifer Weber obviously has been instrumental in putting together the toolkit, so her voice needs to be part of this. Charles Bowman, I think he's on the call. Bank of America has given us some really good insight and feedback. There may be other partners, including folks that have raised their hand. Charlotte is Creative to ASC to the American Advertising Federation. And then the role Michael Marsicano will play in requesting funds to the COVID-19 Response Fund, a grant that will help us with some of the paid and production side of the campaign. So we're looking at doing a totally integrated public service campaign. So it went from, you know, some creative ideas to something, I think, bigger because it's so important. We'd like that to include paid, earned, owned, and shared media. We're going to be working with some local partners to include impact media partners. And we define that as cross-platform, multi-tiered partnership with opportunity for extensive value add. So, not only a broadcast partner, but they've got a digital platform, and there's an opportunity for, interviews and stories to be told. So we'll be looking for those partners. We're estimating, based on a budget I'll share in a minute, about a 16 to 20 week campaign. We've not put that together, but we're thinking about it. How do we sort of dial it up and maybe dial down through the RNC and dial back up again? Hoping for a mid-June launch. If we can pull it together really, really quickly, because we know that the critical nature of this continues to be elevated. I mentioned, but it's worth mentioning again, the multicultural media partner to help reach our Hispanic and African American communities. We've seen elevated cases, and we need to make sure we're getting to those communities out of the gate quickly, and making sure that the messaging is right for them and that it's in the right places for them to receive those messages. We want the paid campaign to share, to align with social media opportunities to tell stories and extend the reach. And then we're going to do everything we can. I think the ask will be for 200 for production and paid media. We're not sure if we'll get that much, but what we're hoping to do is convince our partners to give us a 3-to-1 value on that money we spend to extend the messaging and reach even further. Michael, you want to hit?
Yeah, trying. It's just not
okay.
Seemed to have frozen.
So I talked a little bit about the Lga campaign. We heard about this campaign and thought it would make a lot of sense to connect to what our friends at the state level are doing. We hope to create a local campaign that can live up under the Count on Me NC campaign. As I mentioned, Lga developed this in partnership with Visit NC, NC State, and several other groups. So they're out of the gate. They've developed some similar things in their toolkit to what we've developed, but we think, shared resources are incredible, but we want our messaging to be localized. And so we've been working closely on a creative campaign that does just that. We also want an opportunity to creatively tie into local influencers and pro sports. You heard some of those ideas earlier on. And so how do we get our local influencers to help us spread the word, and through partnerships with, the Panthers and the Hornets and NASCAR to elevate the campaign up even more. And then we think a strong call to action in driving to a local landing page that also is linked to the state's website. Their training and toolkit is also really important. So what does the paid media look like? We think it'll be a combination of broadcast and cable TV, and again, with their multiple platforms, radio, out of home. Those are more traditional medias, but we think that's really important. Those are billboards, print, digital, and then direct mail to make sure we're getting to the neighborhoods that might not have access to the internet and computers and digital messaging. So on the earned and owned media side, and this is where, the national PR group can really get in, where we're hoping many of you will be part of this. But, it'll be a combination of some news releases, press outreach, lots of social media and telling the story and sharing some of our creative messaging, testimonials, op-eds, even a speakers bureau to share information. It'd be great to get some of you involved in that. We talked about the national PR group, how they'll activate in their own organizations, and then even through some of our owned assets, through Center City Partners and other means. And we'll make sure that we're trying to leverage all of those in every way that we can. And then, although these are not covered in the budget, but we think these are really great creative ideas. How do we take these grassroots ideas, partnerships ideas, to spread the word in a compelling way? So, working with ASC, I've already talked through some of these, but how could we modify our big messages out in public? to, share the story. And then partner with, again, I've mentioned it, the Carolina Panthers, the NASCAR, and using some messaging, encouraging them to be part of this campaign. We definitely want to encourage and engage the community to create their own content and share their count on me of why they're wearing masks, who they're wearing masks for, and how they're social distancing. And then also foster beyond the paid other media partnerships to share our content. And then creative partnerships with organizations, maybe like the Saturday and Clean Graffiti. Although I know, that might be a tough one, but they're fantastic, and we could put them in really targeted areas and potentially high-risk neighborhoods. And then, we had the fun idea and would love for a few of you on the call to perhaps get involved in this. TikTok videos are going crazy right now. The idea to, get our leaders to create them and then encourage involvement and maybe even contests. Tell us what you're doing to be part of this movement. Something fun, especially with our younger audiences, to get them involved in sharing their stories. So those are some of the ideas. The goal is to try to get some of this messaging, even if it's a soft launch, out in as early as mid-June. This is fluid at best. We're moving quickly. We welcome anyone that wants to get involved to come and be part of this, but those are the ideas. So I will put mute on and answer any questions.
Well, thank you, Jennifer. That was, that's amazing. Who has questions for Jennifer at this point?
Yeah, Jennifer, this is Fred. Thanks for your presentation and all your hard work towards all of our efforts. Will somebody be reaching out to ask for our assistance with this? Because we'd love to get involved and engaged.
Jennifer, I'm glad to jump in. So when we pull together the National PR Advisory Committee, we want that to be the point where we take the ideas and the creative and the purchased media component and turn it into things that can be licensed freely and owned, so that your organization's a great example where you guys being able to tell the story of why we can count on the Hornets, I think is compelling. And we're going to want to tie that to corporate messages and sports and arts and, kind of across the spectrum. And that's where we hope to tie those pieces in and bring this thing to life. Jennifer, anything you'd add?
Yeah, Fred, the only other thing I would add is, if there's an opportunity to highlight some of your talent and players in some of this messaging, that would be fantastic too. And it sounds like the state campaign is also reaching to some of the teams. So if we could coordinate that, I think it would be efficient and smart. So yes, we will count. So thank you for the question.
Sure, thank you.
Other thoughts? So just so I'm aware, so how is the exact messaging going to be created at this point? So what exactly is the message?
So it's going to focus around some of the guidelines that are coming out of the toolkit, but we've already started some of that creative campaign, and I think on the next call we'll be prepared to share some of that, Dina. But compelling, engaging, empathetic, a little bit of humor to get people to want to be part of this. So we'll be in a good position to share that, I think, at our next meeting. And some of the stakeholders have started to see that campaign. We're working on that, but we're sort of dividing between all the partners we talked about in developing some of those messages.
Okay.
Does that make sense?
Yeah, it does. I mean, this is not what I do, so sometimes it's hard for me to wrap my head around how this all comes together. And
trying to do that, Dina.
Yep.
Trying to do that with a smaller group, just so that we can get some good creative to come back and have folks respond to and be able to then activate.
And can you just tell me who's on the National PR Advisory Committee?
So through our conversations, it sounds incredibly official, and probably an overstatement. This is a group that was pulled together about 10 years ago when we first started launching our national PR initiatives, which Center City Partners began, but it's a partnership between us and the CRVA and the Alliance. The city and the county have been involved, but then there's an advisory group around it with all of our major employers and their corporate communications leads. And we're glad to, I've had a couple folks that are on this roundtable that have said, hey, we'd like to be involved. And they will be welcomed with open arms and invited into that first gathering. We're going to set a date for that first gathering, but we want to have the creative to bring to it.
Okay, because we did get a question in the chat. I think Uday wanted to know, how the Minority Coalition and Carolina Business Alliance can be helpful. They want to participate to try to get messaging to minority business owners. Is that something that you can hook them in on?
Absolutely. That would be fantastic. And I think eventually the ultimate goal, Dina, is to create a similar toolkit so that we could get those messaging and almost templates to this group to, again, spread. So I will reach out and, again, anybody, I'm taking notes from the chat also. So anybody that wants to be involved, it'd be fantastic.
Okay, and is there anything that we need to be mindful of in light of the protests over the weekend? I mean, I think they're separate, but they're not. I mean, I think there's a relationship between, what we're seeing in the African American and Latino community as it relates to COVID and what we're seeing around protests. So have we thought of, I know it's pretty fresh for everybody, but is that something that we need to be cognizant of as we start to pull our messaging together?
I would say absolutely, and that's all new, but I would probably move to some of our more kind of empathetic messages first, but we need to be thoughtful about that for sure.
Can I just chime in here? This is Shantae with the Black Chamber of Commerce. I think one of the things that's being missed in a lot of conversations is actually using groups that are already doing work in the community, including the Black Chamber of Commerce. So if we could kind of start there with the empathy messaging or whatever messaging is trying to go out to our targeted communities. And I think that probably includes the Latino Chamber of Commerce, as well as the LGBTQ community, because we do have intersecting groups. If we could start with some groups that are already doing work, instead of dropping things on people's heads, I think that would go a long way as it dovetails with the protests that are currently going on.
Thank you, Shantae. That's awesome. We'll make sure that the group reaches back out with you. And I don't know for CEO, if that's similar to you from your perspective, wanting to be involved, to reach out to your communities in a different way. Happy to include you in this as well from that perspective.
Yes, thank you very much. And Michael, thank you so much for asking Maura Quinn to reach out to me. I think this is the week when we're going to have a conversation about this. Thank you.
So any other questions, comments, concerns, things we need to be thinking about as the group goes back and develops this messaging? Okay, so the next steps then is you guys are going to go back and get your group together and start to put out, create some of these messages, and then when we have our next meeting. So how long do you think that will take? Because I don't want to rush you too much, but when would you anticipate us being able to have another meeting to talk about this? When do you think you'll be ready?
I think that if you gave us a week, it would make great progress. I do want to check in with the folks that have kind of raised their hands today, but I think we can do that over the next week, Dina, and at least start to show what it's looking like and what some of the messaging is to get some feedback. We also need time to get to our media partners and start, making them aware of this, although some of them have already heard and have reached out, so that's good. But, I would say in another week, we will have made progress, so we could do a check-in.
Terrific. And I had gotten a couple reached out to me as well, and I think I might have forwarded them to you.
We got them. Mm-hmm.
Okay.
Thank you. And then Dina, concurrently, we'll also reach out to the foundation and the United Way to make a grant application for the production and the media buy resources that'll be needed to be a part of this.
Okay, great. Awesome. Thank you so much for this. This is going to be, I think, going to help us a great deal. And I guess this is a good segue for me to turn it over to Gibby to talk about the data and what we're seeing in the data. It'll, I think, solidify the need, why we need to do this. So with that, I'll turn it over to Gibby.
Good afternoon, everyone. Unfortunately, today we are at a total of 123 confirmed cases in the county. That's already today an additional 161 positives. So our numbers continue to rise. We've had 95 deaths. We've had about 6-7 deaths since last Friday. And we've got a couple of new long-term care facilities that have been added today. So we're not out of the woods yet. And when we look at our trends, our hospital use, as well as the percent positives, those numbers have been at the best stable, but starting to trend up a little bit. So we know we still have a need for people in our community to be taking this seriously and doing the things that they need to do to help us keep this from becoming a very large spike. I don't think we're looking at a spike at this point in time, but I think what we're seeing is just a continued expansion of the involvement of our community in COVID. We have, like I said, a little over 4,000 cases, confirmed cases so far. We've got 1.1 million people in this county, and none of them, other than those who may have already had the infection, have any immunity to this virus. So the main thing we need to try to do right now is contain it, and the best way to do that is with masking and social distancing and washing your hands. So this campaign, I think, is timely and is something we need to move forward as quickly as we can. The other thing that Dina asked me to speak briefly about is our expansion in the area of contact tracing. I think everybody's aware that we do case investigation for every new case, and out of that comes the individuals who have been exposed, and that's our contact tracing piece. We're continuing to expand that capacity in our community as we have more numbers, but we are also looking at it from a technology standpoint, and this week are implementing some platforms that should help us to expand our capacity as we move forward. It will streamline the processes for us. So we're continuing to look at how we manage this infection in our community, and I greatly appreciate all the work that this group is doing to educate both the businesses as they open back up. I will tell you, I did go and get my hair cut last week. And the individual who did that was extremely well prepared and did a wonderful job. And I felt very safe the whole time I was there. So I think the information that y'all have been putting out, and as well as this campaign, will be incredibly helpful to our community. So I'll be happy to answer any questions anybody has, but that's all I have to offer this afternoon.
Well, Gibby, just to add on to that, I did go get my nails done this weekend, and my nail salon as well was very prepared. And in fact, before you could walk in the door, you had to scan a QRC code and fill out a waiver before she would let you actually in the door. So I thought that was very creative. So I think people are doing the right thing to open up safely. So I felt good about it. Questions for Gibby on the data and what we're seeing? Carol, anything from your end, from the hospital's end, that we need to know about from that?
Thanks, Dina. Very much in line, Gibby, with what you're saying, and I know our teams are working together. So on the trending and what this looks like, and you're right. I mean, we've seen an upward climb, so it's very consistent with everything that's been said. But we also know that, of course, what we're seeing right now was not today. It was a few weeks ago. So love the way this direction is going in terms of this conversation and the importance of getting the messages out and being really consistent. And also that when you talked about the hair and nails and being safe, that's the first thing that came to your mind. And that's exactly, I think the only other thing I would say is, and I don't know if Jesse's on or anyone from Novant, but I think he would say the same thing, is there's also a risk for people putting healthcare off. So that's why we've gone great lengths to talk about safe care, just like hair and nail salons, because there is a risk with putting healthcare off as well. So just thanks for being such a great partner. We're privileged to be part of it.
Thank you, Carol.
Absolutely.
So that was really our agenda today. I really wanted to talk about, launching this messaging. Always want to update you with the data. If there's anything anybody else wants to raise, this would be a good time. Or if there's other things we need to put on our agenda, I'm happy to put that on for the next meeting.
Yes.
This is Lyle Darnell at Edens. I was curious, is there any update on phase 3? Are we still looking towards the end of June for that date?
Right now, we're still the end of June. I think this phase goes up to June 26th, I believe, is the date when phase 2 is supposed to end. And so we'll wait and see kind of where they go on, in terms of expanding mass gatherings and the like. But that's what I don't see them ending phase 2 early, just based on what we're seeing in the data here locally, and I think statewide as well. The case counts are starting to increase statewide.
I was just asking specifically about the fitness piece of it. So that was.
Others?
Yes, this is Rocio. I won't take long. Gibby, have you or has the department continued to gather information in regards to the industries where the cases are most prevalent? I'm quite concerned that the Latino community's numbers continue to rise, and there's a lot of communication among our community leaders, and we're trying to figure out how we can improve the messaging and how can we serve to make a change.
So thank you for that. We do see those numbers continue to be higher than the population in our community in terms of percentages. And I think, we've talked about this. One of the reasons for that is that many Latinos are working in essential services where it's hard for them to social distance. So we know that's an issue. We have been working closely with the construction industry. We have not seen any outbreaks or clusters, is what the state is calling them now. The state has actually put out a very specific definition around what's a cluster, but what we see is that, this business over here may have 1 or 2 cases, this one 1 or 2, that one 1 or 2, and then they take it home to family. So we are really strongly encouraging, and as much as you can, information around social distancing, around masking when you're at work and those sorts of things. But the other challenge I think that we're seeing is that obviously most of our cases in the Hispanic community have been in the younger population. So we're seeing a lot of individuals who typically are working and need to be working and will sometimes go to work when they're ill because they need to work. And we understand that, but at the same time, what they're doing is they're putting others at risk. So any messaging that y'all have that can encourage people to really protect others by staying home if they're sick would be helpful. I do think we're seeing that in a number of populations, not just Latinos, but especially in our lower income populations who need to be at work and will go regardless of how they're feeling. So we're continuing to try to get that message out, but we'll gladly accept any assistance that you can provide in helping us with that.
Hey, thanks. Gibby, can you just say the case count numbers one more time? I don't think everybody heard.
So we have a total of 4,123 cases as of about 15 minutes ago that have been reported. That just to this point today, and we're not done yet today, That's a total of 161 new cases today. So our numbers continue to rise. We have 95 deaths, and we now have 19 long-term care facilities that are in outbreak status.
Okay, thanks.
Dina?
Yes.
Carol, I have one more thing I just remembered that I think might be helpful to say, and this is probably not all that new, but I know at Atrium what we're doing is trying to approach this really from a dual world. You know, we have to look at both. Everybody wants to get back to normal. We all do, and we need to be working on that. At the same point, you know, COVID is here and it's not going away. You know, we do believe that there will be ups and downs, and there will continue to be. So I think as we work on the campaign, Jennifer and Michael and team, I think that's important. You know, you think about a campaign as a surge of getting out there, but this is sustainable, long lasting, because getting these messages out and getting to, we're calling it now the next normal. It's not a new, maybe it's new normal, but it's our next normal, and there will be one after that too. But this is here to stay for a while, is the way we're operating. So I would just challenge all of us to think about that as we really try to get back to reopening everything, but with the caveat that it is a different world, and to be very, very careful, and think that you're just operating sort of in a double world right now.
Yeah. Thanks for that, Carol. I would agree completely.
I have a question. Do we have can I just make the assumption that now that reopening has started, it's not going to slow down at any point, even if the case numbers or deaths or whatever, any indicators increase?
Well,
I know it's a hard question to answer, but I think I'm just kind of, everybody's talking about the new normal, or I like the next normal. That's kind of that's a catchy phrase there. But you know, it's almost as if we're just saying, yeah, they're gonna go up. We know they're gonna go up. More people are going to die. We'll have to figure out how to deal with it. Is that essentially our plan kind of going forward?
Well, I don't think that's what we're saying. I don't think no death is acceptable to COVID. But I think what we've learned, and Gibby can obviously speak to this better than I can, is that we really need to figure out a way to prevent the spread. And we have to do that and try to balance the need to reopen our county. You know, kids are going to have to go back to school. I mean, we have to, and I don't have the answer to what that looks like, but we've got to figure out what that right balance is. But I want to just repeat this again, that no death to COVID is acceptable.
I'll just say out loud, just as far as my business constituency, since it's predominantly African American, there's a huge concern both on the economic front and on the case front. And quite frankly, having to go to work and having to choose to put off healthcare is a really big concern for people. And so they really feel like they're between a rock and a hard place. And so I'm getting questions about how to balance the two. And I don't have the answers, and I can't really point to it. If things get to XYZ point, you know, this is what's going to happen, or this is how you'll be protected. So that's really what I'm struggling with at this point.
Gibby, do you have anything to add there?
Yeah, I think what you're talking about is exactly what we have to pay attention to as we move forward. We are watching several different trends. One of the things we want to make sure of is that we continue to have the capacity in our hospitals to address the issues in our community. So, you know, as our numbers go up, if we start seeing more and more individuals needing to be hospitalized and our hospitals being pressured around their surge capacity, then I think we need to pay attention to that and decide what we need to do to address it. But the reality is, like I said earlier, this virus is in our community, and it's not going anywhere anytime soon. We have a lot of people who are still susceptible to it. The only thing that can prevent that would be a vaccine, and we know we're not going to have that right away. So what we're in the middle of right now, and will be, I think, probably for the rest of this calendar year, is a balancing act between opening things up enough so that people can be functional and can make a living wage if possible and do what they need to do, while at the same time limiting our activity enough to keep from spreading this too rapidly. So that it's a balancing act, and I don't think we can do totally one or totally the other. It's sort of what Carol was talking about. We've got our feet in two different worlds, and we're trying to sort of straddle that and make it work. And I think that's going to be ongoing for some time. So I think looking at the data and watching it and making sure that we're not making things worse with some of the things we're opening up, but that we're also allowing people to do what they need to do is going to be sort of the mantra moving forward, I think.
That's a great question, though, Dr. Shante Williams. Thank you for putting that in the room for us. Any other questions or comments?
Uday here. Just wanted to check, Gibby or Dina, do you plan to increase the number of testing in the coming weeks or months? I know because people are coming out, there might be more people getting infected. So is there any plan to increase the number of testing so that people can take better quarantine measures that way?
So you may have seen that CVS Pharmacy opened 9 of their sites around the city, around the community to provide testing on Friday. And people can just go to their website and take a little screening test and sign up for a test. It's an appointment situation. The good news is that they are accepting insurance if you have it. There's no copay. And for those who don't have insurance, there is a billing source for them, so they don't have to charge. So if anyone who needs it can get it. Both of our hospital systems are expanding their ability to test. So we're seeing more tests coming through our hospital systems. And the state has just put out, I think they called it an RFQ. Not sure. Today, that would allow others in our community, especially those who serve underserved communities, to do some testing, and the state is willing to support them in those efforts. So we're gonna do what we can to try to make sure that all of that testing becomes available. And as I said, we are testing more right now. The numbers we're testing are anywhere from 1,500 to 2,000 a day. But that's before CVS started on Friday. And I think they have the capacity of about 450 a day across their 9 sites. So we will see more tests being done.
And there's also new guidance around how we're going to be testing long-term care facilities, which, is a special population, but it will expand how much testing we do in the community, particularly for people who work in those facilities. So that's something that'll be coming up in the next few weeks as well.
Thank you, ma'am.
Other questions or thoughts? Okay, well, thank you everybody for joining the call today. It's always good to see you all, and I'll be back in touch for our next meeting. Have a good week, everyone. Thanks.
Thank you, Dina.
You're welcome.
Bye. Thank you.